Okay, so today we will be discussing interprofessional collaboration between speech and language pathology, occupational therapy, and physical therapy. In this presentation, we will be presenting information about each different profession. We will be showing some professor interviews, demonstrating a video of a patient evaluation, and talking about the impact of interprofessional practice and learning. We'll start with occupational therapy. Um, So, occupational therapists and occupational therapy assistants help people across the lifespan participate in the things they want and need to do through the therapeutic use of everyday activities, also called occupations. So, what are occupations? They are everyday personalized activities that people do to occupy their time and bring meaning and purpose to their life. Occupations can be categorized into activities of daily living, instrumental activities of daily living, health management, rest and sleep, education, work, play, leisure, and social participation. A little bit about the history of the OT profession. Social consciousness and the moral treatment movement in the 17 and 1800s brought more attention to physically and mentally disabled individuals and how they were treated and cared for. So people were needed to care for these individuals and keep them occupied and engaged in different activities. That's kind of where OT began. So the occupational therapy profession originated with these populations and kind of planted its roots in the mental health area. After World War I and World War II, occupational therapy moved towards a physical health focus while working with injured soldiers returning from war. At this time, medical equipment was also improving, and assistive devices were being incorporated into rehabilitation and are still being used today. So, occupational therapists can work with individuals throughout the entire lifespan. You can find OTs working in settings such as hospitals, schools, nursing facilities, outpatient clinics, home health care, academia, early intervention in the community, and in mental health settings. OTs also tend to focus on the areas of children and youth, health and wellness, productive aging, rehabilitation and disability, work in industry, and mental health, but the field is still emerging and evolving. OTs must always consider their clients' occupations or the meaningful and purposeful activities their clients want and need to engage in. OTs must also consider the context and environments of their clients, performance patterns, motor, social, and cognitive skills, and other factors. OTs are trained in activity analysis as well as skilled observation. When working with clients, OTs evaluate by completing an occupational profile and analyzing clients' performance. Once an intervention plan is created, it is implemented and reviewed, and the outcomes are measured and adjusted as needed. But the main goal is to help clients achieve health, well being, and participation in life through engagements in occupations. So, to become an occupational therapist, you first need to obtain a bachelor's degree and then graduate from an accredited OT program. You can either get your master's of occupational therapy or your doctorate of occupational therapy. After OT school, you will complete fieldwork requirements, then pass the NBCOT certification exam, and then obtain a state licensure. The job outlook for OTs is expected to grow according to the Bureau of Labor and Statistics. It's expected to grow about 16% from 2019 to 2029.
All right, so next we're going to talk about physical therapy. So, what is physical therapy? It's provided by physical therapist and physical therapist assistants who promote, maintain, or restore health through physical examination, diagnosis, prognosis, patient education, hands-on interventions like exercise prevention and health promotion. Physical therapists are licensed healthcare providers that are movement experts. They evaluate, diagnose, and manage a wide variety of health condition and movement problems across the lifespan and individuals of all abilities. We can help maintain or improve quality of life by providing evidence-based interventions, patient education, and movement prescription. Was in the United States, where it started was with reconstruction aids that helped. So next, the duties and skills. And so part of the physical therapist's job is to gather relevant patient information about why they are seeking care, how their condition is impacting their everyday life, and what they would like to get back to. As we assess different movement qualities and help find movements that reproduce their symptoms. We help build a treatment plan that is individualized to each patient that is seeking care. And we help with their symptoms by providing evidence-based interventions that help with symptom modulation, increase motion and strength, and functional tasks, and provide patient education. Website, and it says that physical therapists help provide interventions to prevent or improve many chronic conditions and diseases, and provide treatments and strategies to improve and restore movement and function, manage pain and lessen symptoms of many conditions and diseases, and recover and prevent injuries. The target population for physical therapy is the entire lifespan. Physical therapists and physical therapist assistants work closely together, and you can find them working in a variety of settings, including hospitals, private practice, outpatient clinics, home health, schools, sports or fitness facilities, nursing home, and rehab facilities. And so some general areas or specialties of practice can be acute care, geriatrics, home health, neurology, women's health, and pelvic health. So some of the educational requirements is that to get into a program, you must earn a 4 years bachelor degree. And the DPT program is 3 years in length, and it's a combination of classroom and clinical education. And to practice, you must earn your doctorate of physical therapy and pass a state licensure exam. And the job outlook for physical therapy is that the profession is projected to continue to grow, and the demand is going to be coming from the aging baby boomers, other chronic health conditions like diabetes and obesity, and those with decreased mobility who are being less active throughout their life.
So next we're going to talk about speech-language pathology. Speech-language pathologists work to prevent, assess, diagnose, and treat speech-language, social communication, cognitive communication, and swallowing disorders in children and adults. The history of speech-language pathology is that speech pathology started in American schools with teachers who took a specific interest in speech skills and worked on correcting them. It was also regarded to have started in Europe with an interest of being perfect in the way that one spoke. It has evolved greatly over time and included all the different parts of the field that we see today, as well as adding more and more education to provide the most skilled services possible. The target populations can go from all ages, premature babies to geriatrics. So how we would work with a premature baby would be not necessarily on speech, but possibly on swallowing in the NICU. The settings include acute care, rehabilitation, schools, and private practices. We like to say that we have a wide variety of focus areas, so including fluency, speech production, language, both receptive and expressive, cognition, voice, resonance, feeding and swallowing, and auditory rehabilitation, as well as rehabilitation. The field of speech language pathology has seen an immense amount of growth. A few reasons for this include, but are not limited to, older populations, baby boomers, improved survival rates, increased school enrollment, and demand for direct and contract services. Excellent job opportunities in speech language pathology are expected to grow by 25% from 2019 to 2029, faster than the average for all occupations. As a result of this growth, approximately 40,500 speech language pathology jobs will be available over the 10-year period. Of the 211,000 professionals whom ASHA represents, approximately 181,628 are certified speech language pathologists, and 785 hold dual certification as both audiologists and speech pathologists. The educational requirements include an undergraduate degree in communication sciences and disorders, or speech, language, and hearing sciences, but is recommended, but also leveling courses can be completed at some universities. Sometimes this is called post-bachelorette education, and when another degree has been attained before finding the field of speech pathology. Next, a master's degree in speech pathology is required. It is recommended that this be completed at a university accredited by the American Speech, Language, and Hearing Association. Then a clinical fellowship year is completed before being able to apply for the clinician's certificate of clinical competence from the American Speech, Language, and Hearing Association. So next we have our professor interviews. Each of us took the time to meet with one of our professors and ask them these 4 questions. How do you think that practitioners benefit from interprofessional practice? How do you think that patients benefit from interprofessional practice? What are some of the main challenges of interprofessional practice? And tell us about a time you had experience with interprofessional practice. Our first one is Kevin Anderson.